Welcome to Let's Talk Liver, our podcast covering all things liver health, as the name suggests. I'm Jackie Seawood, a hepatitis nurse working in New Zealand. During each episode, I'll be talking to someone working in the liver health field, and we'll do our best to answer all your questions and teach you everything you need to know about liver health. Today we have Alex Lampen-Smith with us, talking about who should get tested for hepatitis B and how to manage the virus if you have it. Alex works as a gastroenterologist and a hepatologist at the Bay of Plenty District Health Board. She is also a clinician at the Hepatitis Foundation of New Zealand. Welcome, Alex.
Hi, Jackie. It's great to be here.
Thank you for coming in today. How's the weather in your area?
Not too bad, not too bad.
Pretty cold and blissful out here and where we are. Anyway, who are you and what is your role at the Hepatitis Foundation, Alex?
Yeah, so I'm a medical doctor and I specialise in gastroenterology and hepatology, so guts and livers.
Nice.
And as well as working at a hospital, I also work with the Hepatitis Foundation. So in that role, I work with our nurses and our support staff in supporting people all throughout New Zealand who have hepatitis B.
Fantastic. How long have you been with the Hepatitis Foundation, Alex?
Since 2016.
Wow. So, by the way, what is hepatitis B and how will it affect me if I actually have it?
So hepatitis B is a virus that can be present in people's livers, and it's commonly found in many different parts of the world, and
Right.
for most of the time no one knows they have it. They don't have any symptoms from it, but
Wow.
if it's in a person's liver for years and years and years and years, it can gradually cause damage, and it's only when that damage has been present for a long time that the person may experience actual problems.
It's quite scary to know that you don't usually get symptoms until it's really serious. So saying that, so who needs to actually get tested for this?
Yeah, so the parts of the world where it's most commonly found are the Pacific
Right.
Islands, Asia, Africa, Middle East, Southern Europe. And if anyone is born in any of those countries, they should know their own hepatitis B status and get a Hep B test.
Right, and is there an age criteria we should be looking at?
Yeah, that's a really good question. Vaccinations for hepatitis B have been available around the world since the late 1980s, but
Right.
different countries have introduced that vaccine at different times. So, for example, if you've born and come to New Zealand from a country that hasn't had the ability to roll out that vaccine straight away,
Yes.
then that person may not have been protected. And so even if they were born in the 1990s, they should still get a check. Whereas in New Zealand, we know that the highest areas where hepatitis B can be found are in the northern or eastern parts of New Zealand's North Island specifically. And in New Zealand, we've had a vaccination for hepatitis B available to all children born in New Zealand since the late 1980s. So theoretically, people born in New Zealand from the 1990s onwards should be safe. But for people born in New Zealand prior to the late 1980s, they could also have it and not know about it.
And as you said, in those more rural kind of areas, when the rollout of hepatitis vaccination wasn't as popular, it would sometimes be a bit later than those dates.
Yeah, definitely.
So, so why do we need regular testing once we've found we have hepatitis?
So hepatitis B is, as we were saying, it's something that can be present for many, many years, and
Right.
the damage only shows up later. And sometimes the first inkling that we get that there's a problem arising is if the monitoring blood tests show that the liver is inflamed. And so how we do that is we recommend, as does the World Health Organization and the big liver specialist organisations around the world, is that people with hepatitis B should be getting monitoring blood tests every 6 months. And in that way, it allows us to see if there's any sign of inflammation happening in the liver and if any further tests might be needed.
And I suppose it goes back to what you said before, that there are no symptoms until the liver damage is bad, and that these blood tests would actually pick up things that are happening within the liver.
That's right.
So what do you mean, what do my blood tests kind of mean?
So what we look for on the blood test, so the Hepatitis Foundation, for people that have hepatitis B in New Zealand and are enrolled with our service, we will send out blood forms every 6 months. And what we are looking for there is whether there's any signs of the liver blood test, which is a whole panel of a whole number of different parameters, whether any of them are up higher than what they should be. And if they're up, are they up a little bit? Are they up a long way? And then we look to see whether they could be up because of the hepatitis B virus, or whether they could be up because of something else, in which case we'd ask them to see their GP.
Right, and if you had your levels up and they weren't to do with hepatitis, say your viral load was very high, what would actually happen there, Alex?
So if the liver blood tests are up, and then we would go on and check the hepatitis B virus level, how much virus is present at the moment. If that is also up, then that pretty well goes hand in hand and says it's probably the hepatitis B virus that's causing the liver blood test to be up. And in that situation, we would definitely usually recommend that the person be seen by someone and have a discussion about starting treatment.
Right, treatment. And treatment is like medication?
Yeah, so at the moment around the world, the best medicines that we have available for managing hepatitis B are very good at keeping the virus count really low. So if you take these tablets regularly, the virus level will be suppressed down to really low levels. And we know that this is important to reduce the damage happening in the liver now and reduces the risk of future liver problems. These tablets, though, do have to be taken in the long term.
Right. Now, one thing that has come up a lot of the time, and I see all over the internet and I get questioned by my patients, is there a cure for hepatitis B?
Yeah, that's a really hot topic at the moment. The other big virus, which has been in the news a little bit, has been hepatitis C, for which there now is a cure. And it's rightly so that people affected by hepatitis B are also wanting to know, is there a cure for hepatitis B? So despite the fact that their names sound very similar, the two viruses are actually quite different. And at the moment, no, we don't have a medicine that can cure hepatitis B. But there is a lot of research and a lot of effort by very clever people all around the world working on medicines, new medicines, to try and help people really get rid of the virus properly and once and for all. But at the moment, the best we have is medicines that suppress the virus.
I look forward to that day. Now, just a bit of a topic also that I get asked a lot is about pregnancy. So if I'm pregnant, can hepatitis B actually affect my baby in any way, Alex?
Yeah, so the hepatitis B virus, babies can get it at the time of birth, and that can happen if the virus level in the mum's blood is really high. That means that the baby is at risk of catching the virus at that time. So it doesn't make the baby sick, but what it means is that baby then is highly likely to go on to have chronic long-term hepatitis B themselves. So we do recommend that mothers affected by hepatitis B speak to their midwife and get their hepatitis B checked out to see whether, what needs to happen around the time of the delivery of the baby to protect the baby as much as possible.
Fantastic. And I know that you're such a busy doctor, and I don't have any more questions that I can think of, but is there any take-home notes you'd love to leave with us today, Alex?
Yeah, so I think testing for hepatitis B is important for anyone who's come from many parts of the world where hepatitis B is common, for people to know that they have it and then to be getting that regularly monitored. That would really be the main things. Once you're in a monitoring program, that our services can help walk alongside people to manage their condition with them.
And does the Hepatitis Foundation cost the person any money, just as a thought?
No, it doesn't. It's a charity organisation. We receive funding from the Ministry of Health, and the service we provide to people in New Zealand affected by hepatitis B is free.
That's fantastic. Hey, Alex, thank you so much for your time today. I think a lot of people have probably learned a lot from today's podcast, and I hope everyone has a fantastic day. Look forward to talking to the next person.
Thanks, Jackie. All the best.
Bye-bye.